10 pregnancy complications which you need to be aware of. Congrats! You are pregnant. Now is the time when everybody in your family would be happy and celebrating, as they come to know about the little bundle of joy that is soon to arrive in your arms. While this is a great time, you need to remember to take good care of your body. Since there are chances of developing few complications during pregnancy period. Learning about the top 10 pregnancy complications would help you stay alert and get immediate medical attention in case you experience any of the symptoms related to the said complications. 10 pregnancy complications which you need to have an eye on. If you come across any one of the following symptoms while you are pregnant, you should seek medical attention immediately. 1. Bleeding during your pregnancy. Bleeding in your pregnancy might occur due to various reasons. If your bleeding is continuous and followed by severe pain in the abdomen, you need immediate medical attention. In addition, you may have cramps, similar to your menstrual cramps. If this happens during the first trimester, this may be due to ectopic pregnancy. This could be due to the implantation of the fertilized egg somewhere else other than the uterus, and at times, it can be a threat for your life. Bleeding during your pregnancy is very dangerous and life-threatening, especially during the third trimester, as it may be due to placental abruption. 2. Excess vomiting and nausea during pregnancy. Though it is natural to experience vomiting and nausea during your pregnancy, it can be a complication if you experience it too often. During your pregnancy, it is important for you to eat and drink in the right amount. When you are unable to drink or eat, your body becomes dehydrated, and this is a dangerous one. When your body is malnourished and dehydrated, the condition could affect your baby. If you have severe vomiting and nausea, you have to seek the advice of a gynecologist immediately. 3. Decline in the activities of your baby. Though no two babies will have similar energy levels, it is important for the baby in your womb to move at a regular pace. This is why your doctor asks you to keep a track of your baby's kicks. If your baby is not moving, try drinking something cold and lie on your side to feel the movement. You can count the kicks from your baby every day to know when the baby is not active. If your baby kicks more than 10 times in 2 hours, it means that your baby is in perfect condition. If you do not feel that your baby is kicking as prescribed, it is better to visit the doctor for further discussion. 4. Severe contractions during early third trimester. If you are pregnant for the first time, it is not easy for you to feel the difference between contractions related to true and false labors. Contractions that are false would not have a rhythmic pattern, have no intense pain, and are not predictable. Such false contractions subside in an hour's time. If you experience frequent and painful contractions for more than 10 minutes continuously during the early third trimester, you should make a call to your doctor for immediate appointment. 5. Experiencing water breaks. All of a sudden, you may feel a flood of water rushing down your legs, and there are 2 reasons for this. If your enlarged uterus pressurizes your bladder, there may be a leakage of urine. In many cases, this would be your water breaking in the form of a dramatic gush. When you are not sure about the leakage, you can go to the toilet to empty the bladder. If the fluid is gushing still, it must be due to the broken water. An emergency call to your doctor or going to the hospital is the solution for this complication during pregnancy. 6. Symptoms for flu. It is better to have a vaccination for flu during your pregnancy, as it would prevent you from falling sick, leading to many complications. If you have flu, make sure you call your doctor for medication. This way, you will not be spreading the flu to other pregnant women in the hospital. 7. Signs related to preeclampsia. If you have swelling, abdominal pain, visual problem, and severe headache, it means you might have the symptoms of preeclampsia. Normally, these symptoms might occur during your third trimester, and is considered to be highly fatal. Lack of prenatal care is one of the reasons for this condition and needs immediate treatment. This complication occurs when you have a high blood pressure and your urine might have excess protein. 8. Premature labor and birth. If you are in the middle of 36 weeks of pregnancy and begin to have regular contractions which can make your cervix become dilated, this indicates you are facing preterm labor. This indicates you will give birth to your baby before 37 weeks. This can be fatal to your baby. 9. Underweight babies. The complication of low birth weight is caused by your poor food eating habits and usage of illegal substances. The underweight baby may have respiratory infections, cerebral palsy, blindness and learning disabilities. If you wish to prevent this complication and give birth to a healthy baby, you should have nutritious meals with fresh fruits and vegetables. In addition, you have to stay away from smoking cigarettes and alcohol consumption. 10. Gestational diabetes. This complication in pregnancy is a common one among pregnant women and is a serious one too. If you get gestational diabetes during your pregnancy, your doctor would advise you to stay on a diet and take regular blood tests to monitor the glucose levels in blood. Make sure you don't give in to your craving for sweets as it can have serious effects on your baby. With so many complications of pregnancy to deal with, you can carry a healthy baby to term if you follow the right diet, maintain a healthy lifestyle and perform simple workouts while keeping a check on your baby's health and yours.